Hello, I'm Erin Palmer, Team Rayceen Productions co-host and moderator. And joining me is the goddess of DC, Rayceen Pendarvis.
Bam! Greetings and salutations all.
Joining us is Councilmember Christina Henderson. Hello.
Hi, Erin. Thanks so much for having me.
How are you today? And before we ask any questions, please give us a brief introduction.
Well, thank you so much again. So I'm at-large Councilmember Christina Henderson. I am one of the five at-large members for the DC Council representing the whole city. I also have the privilege of serving as chair of the Committee on Health, which has budget and performance oversight for the health cluster. That includes hospitals, primary care, Medicaid, animal control, DC Health, anything under that realm. And so I've been serving in this on the council since 2021.
We're so happy to have you here and to ask you some substantive questions. And we'd love to start with traffic safety. Could you give an update on what you've been working on and how those measures will improve pedestrian safety and other safety for road users?
Yeah, well, as you know, Erin, I've been serving on the Transportation and Environment Committee since I became a council member, and dealing with the issue of traffic violence has been one of those things that has really been at the forefront of my mind, and a lot of the work that we have been doing. The fact of the matter is, unfortunately, even though we have a commitment to Vision Zero across DC government, the numbers are not bearing that out. Right now, or at the latest numbers, we have we're a 38% increase in traffic fatalities than where we were last year. A lot of those being folks who live east of the river, and many of those unfortunately being children as well. And so some of the bills that I have recently introduced would get at closing some of the loopholes that lead to some of the traffic violence that have taken place. So for example, right now, if you are to get pulled over for a DUI, and what your DUI might have caused an accident or caused someone to lose their life, your license is not suspended automatically. Your license isn't suspended until months later when you are convicted and going through the adjudication process. And I feel like if you have an accident or a incident that takes the life of another person or severely injures someone or severely damages property, you shouldn't get to keep driving in the months interceding your accident and your conviction. And so I introduced legislation along with several of my colleagues that would your license would be suspended immediately when you are charged. Also, you guys know the drama around automated traffic enforcement. But automated traffic enforcement tickets are treated differently than a ticket if a law enforcement officer gave it to you. So if you get a ticket from a law enforcement officer for going 25 over the speed limit, not only do you have to pay a fine, but you also get points on your license, which can, accumulate over a certain amount of time. If you get a ticket from automated traffic enforcement for going 25 over, if you pay the fine, it's fine. And I just kind of feel like if you're going 25 over, particularly in a school zone and other places, that's a dangerous driver and you should be penalized for that so that we could try to correct the behavior and just keep people safe.
I applaud you and thank you for all the work that you're doing. And when we talk about health access east of the river, continues to be an issue for residents. Please tell us about Cedar Hill and what is being done in Ward 7 and 8.
Yes. So Cedar Hill Regional Medical Center is the newest hospital that's coming to the District of Columbia. Knock on all the wood that we won't have any more delays in terms of construction to make that happen. Right now, we are at a place in DC where we don't have a hospital east of North Capitol Street that has labor and delivery services, nor can accommodate significant trauma cases. And so Cedar Hill is being built on the campus of St. Elizabeth's campus, and we're partnering with UHS and Children's National to provide services there. In addition to the new hospital, we are also opening up smaller urgent care centers in Ward 7 and 8. Again, trying to expand the health infrastructure that we have in communities so that folks don't have to take 2 buses and a train to get to the doctor's office. So the urgent care facility, one of them has opened. We're waiting on the second one to open up over there. And then Cedar Hill is supposed to come online in Q1 of 2025. So again, knock on all the woods that we make that happen there. But I'm really excited about this project. I'm really excited about what this can mean for health access for residents on the east end of the city. And not just for the residents there, but also for individuals who are looking to get into the healthcare field, to be able to work in your neighborhood, to be able to work in your community, I think can be really transformational for some folks who want to be doctors or techs or nurses or, all the various other things that go into making a hospital run. Cedar Hill is going to be hiring. And so this is a really great opportunity for the community.
That's such an important development, and I share your sentiment that it happened quickly and no further delay, because it's an inequity that has existed for quite some time. On the issue of health, I know that you had recent legislation related to IVF, the Expanding Access to Fertility Treatment Amendment Act. And can you tell our viewers a little bit about that legislation and its status? And what it will bring for residents?
Yep. So that particular bill is really based out of a place of wanting to ease the burden for individuals who want to start families, but either have troubles doing so because of fertility issues, or might be in a same-sex couple and they don't want to go the adoption route. They'd like to go a different way, but it is financially prohibitive for folks to do so. It's interesting when I talk to folks, the first thing that they think about when you talk about IVF is just very rich people because of the expense and cost of it. And for me, having challenges with fertility, that's a health issue, and your health insurance should cover it. And so this legislation would expand health insurance coverage to cover, for those with private insurance, to cover IVF treatments and diagnoses, as well as medications. DC would be joining several other states, including Maryland and West Virginia, and having this required coverage option. And then for Medicaid and Alliance beneficiaries, this legislation would require coverage for medications and ovulation treatments. So this would be the most expansive option in terms of the fertility space for Medicaid recipients. We would be joining New York State as the only other state to provide this additional coverage. And, frankly, I heard from a lot of families in my DMs, sending messages, sending emails, because fertility or infertility is something a lot of people suffer with in silence. A lot of what's wrong with me, a lot of shame that's associated with it. And when someone then tells you, yes, we could potentially fix this problem for you, but it's going to cost $100,000. There's just so much that's there. So we passed that legislation. It's now on the mayor's desk. I just checked. She has until July 20th to sign it. It's July 18th for the viewers who might be watching this later. So I'm hopeful that we'll be able to move this forward, and then coverage for private insurance would start in 2025. For Medicaid and Alliance, it would start in 2024. The bill is paid for. So I'm really excited that we're going to have this option for families in the district.
Wow, that is so amazing for so many folks who have that issue surrounding their concerns of health and their body and their wellness, and just relieving a lot of that mental stress that comes along with worrying about how do you get this paid? How is this,
right?
How can this help you? And that's amazing. And, when we think about amazing work, you have an amazing situation coming up. What would you like people to know about the Maternal Health Fair in August?
Yes. So my office is partnering with a few community organizations to do a maternal health fair on August 12th in Ward 8 at Bard High School, Early College High School. And the impetus was this, one of the foundations that we're partnering with, the young woman for whom it was named for, she died shortly after giving birth. And her family wanted to prevent this from happening. DC has the highest maternal mortality rate in in our area, in our region, in our country. And frankly, we just have too many folks who are dying. But also, when we look at the numbers, even though DC boasts having 98% of the individuals in the city having health insurance coverage, we still have so many women who do not seek prenatal care until their second or third trimester, or even at all, particularly Black and Latino women. And so this maternal health access fair is really about getting information in. So we'll have folks who's doing blood pressure checks, talking about resources, talking about doulas, which are now covered under Medicaid, and all of the various things that can help. Basically, how can we put some more information out there for families, to bring down the rate of young people, or of women, young people, all pregnant people who are dying unnecessarily from things that can be prevented with care and monitoring. So we're really excited. This is the first time that we're going to be doing this. It's a little unique because, a lot of my colleagues are doing a lot of back to school events. This is kind of back to school-esque, but we just want to make sure that folks are starting off the year healthy and right.
Well, speaking of back to school, it is heading into back to school season. It's already something I'm thinking about with my children, for better or worse. And we're wondering if you have any updates on back to school issues in addition to the maternal health fair, anything else you would like to share with viewers?
Yep. So, there are going to be all across the city events, giving out backpacks, school supplies, you name it, we probably have it. And so I just want to let folks know that this is now the time to stay engaged and stay plugged in. If your kid needs something, if your kid needs to get immunizations, which are super, super important. DC Health is going to be partnering with Children's National to do several, pop-up clinics. So you can just go there and get all of them done at one time. Because I know sometimes getting a pediatrician's appointment right before school starts is just a really difficult thing to do. But we want to make sure that our young people are protected and are starting the year off right. And so that's everything from making sure you have your uniforms and your backpacks, but also making sure that internally your immune system is protected too. So, yeah.
Councilmember, is there anything else that you're working on that you'd like to share with us?
Oh, there are always things brewing. We just did a count in terms of the health committee did 29 hearings over the first portion of this year. The council just went on recess. So we have a number of bills that are in the queue that we will be marking up. One on prior authorization, which is like a very technical thing, but actually works a lot for residents. When you have a procedure or you need to get a drug or something, the prior authorization process with insurance companies can hold up processes. And so we're making some reforms in that area. We have a bill on telehealth, which exploded during the pandemic. And now we just need to put some rules around it to make sure that folks are protected. But that also, we're not eliminating innovation in this field for things to move forward. We just had a really amazing hearing on opioid use and overdoses in the district. That's something we're going to be working on very closely. DC right now we're number one in overdoses in the country. Not a lot of people are talking about opioid use right now because, at the time that it was really prevalent in the news, people thought that this was like a West Virginia and Vermont and rural country area, but no, right here in the district. Last year we had over 3,600 overdoses, 458 of which were fatal. And I just don't feel like we're talking about it enough. So we got some work to do on that front. We also did a great hearing on providing emergency access to albuterol. So this is young people who have asthma. We have a really high pediatric asthma rate in the district, but not a lot of young people who have medications or action plans on file at school. And so we want to make sure that we are getting medications into schools so that if a young person has an asthma attack, the school personnel officials can help try to save that young person's life until FIMS gets there. And so, yeah, we got a lot of stuff working in the fall. We're just gonna be we're going to be legislating and turning out bills, but also quite a bit of oversight happening right now this summer. Medicaid redeterminations are happening. So, you know, folks, if you're listening and you're on Medicaid or you know someone who is, please tell them, don't throw away the letter that they got from the Department of Healthcare Finance. This is super, super important. You need to fill that out. You need to maintain your coverage because you don't want to have an emergency situation where you need health coverage and then you find out that you've lost that because of a paperwork issue. So lots of stuff going on.
And that's amazing. It's so wonderful. I just love our city as a whole because I feel like the nation's capital is always the forerunner for so many things going on. And the rest of the country just has to get in line and take orders and follow and learn from us. And that's the joy of the greatness of our city that I'm so proud of once again. But of course, please tell our viewers how they can learn more about you and what's upcoming.
Yes. So the council is on recess from now until September 15th. So we won't have hearings going on, but as I mentioned, lots of events that are coming up. So if you want to stay tuned and stay plugged in, you could check out my website, ChristinaHendersonDC.com. I'm also on Facebook and on Twitter at CMC Henderson. And if you're interested in watching some of our past hearings, they're all on our YouTube page at CMC Henderson as well. And so that's usually where we plug things up. Folks can certainly sign up for our newsletter as well, because we send out information twice a month.
What a wealth of information. So viewers, please look in the description below for links. And Councilmember Henderson, thank you so much for joining us. This was very informative, and we are grateful for the work that you do, particularly on public health and health equity. Thank you for joining.
Thanks, Erin and Rayceen, for having me. It's always good. Always good to be with you.
Always a pleasure.
To those watching, please follow Team Rayceen on social media and subscribe to the Team Rayceen YouTube channel.
Viewers, thank you for watching.